Okay, this video is called the Sam Kinison Theory of Treating Pain. So Sam Kinison was asked to donate money to people in a country where most of the people were starving. And Sam Kinison said, "You live in a desert. There is no food. There's never going to be any food there. Don't send food, send luggage." Okay, and in a sense, I feel the same way a lot of times when I'm talking to patients. The same thing like when I'm looking at CT scans of brains and spines. I'll see all the arteries are all calcified and narrowed from severe atherosclerosis, and there's very poor blood supply. And it's like there's never going to be any good blood supply there unless they dramatically change their atherosclerosis risk factors. And if the blood doesn't flow, the body doesn't go. And so like a typical conversation I'll have is, recently one of my relatives sent their friend to talk to me, a 60-year-old lady. And she says, their husband's arm's been hurting for about 6 months, and they don't know why it's getting worse. So I asked him, well, has he seen his doctor yet? And she said, yeah, but the doctor just gave him pills for the chronic arm pain. I asked her if her husband knew what was causing the pain. She said that him and the doctor think it's probably a disc herniation in the spine, but they don't know for sure. I said, well, the first thing your husband should do is, eat that low-fat, low-sodium, whole food, 100% organic, vegan diet with no processed food, no oil, no caffeine, and you should filter your water. She got real annoyed with me. She gave me this annoyed look, and it was like her look said to me, I asked you a serious question, and you respond with this nutrition nonsense. Your wife is right. You are autistic. Why do you waste my time? And I looked back at her and said, look, I know what I'm talking about. I deal with complex spine disease every day. I've seen many thousands of spines. And I can tell you, most of these older Americans, they got a lot of calcifications in their thoracic aorta, quite often calcifications in their subclavian arteries, their vertebral arteries, and they have poor blood supply to their spines. You look down their spine, and it'll be half or more of the disc spaces in their cervical spines will be all narrowed from ischemic degenerative disc disease. Same thing in the lumbar spines. And if you want anything in the body to work, anything, it needs good blood supply. Also, the same things that reduce dietary risk factors for atherosclerosis and hypertension and diabetes, they also will tend to reduce dietary risk factors for inflammation. Once you reduce all these things, you will better maintain the endothelial glycocalyx, which is the endothelial function, the health of the arteries supplying the spine and other parts of the body. So, when you get better blood supply and you reduce inflammation, you will often dramatically reduce the pain. I know that from clinical experience. I also know that from my personal experience. I went through a fat phase in my mid-30s, and I would wake up in the morning and my feet hurt. I don't know, I had some fat-related foot neuropathy or something, and I had mild chronic back pain. I had these weird little aches and pains. All that stuff went away completely, 100%, after I became a vegetarian, and that's never come back. I used to have old shoulder pains from my old wrestling days. All that went away too. So what I'm trying to say is, there's not a guarantee. You're not going to fix a rotator cuff by going low-fat vegan, but you'll optimize the blood supply to it. There's a good chance you'll take the edge off the pain. And that's what you want to do for starters. And then you can go through the whole process of figuring out exactly what's causing the pain. Does it need any additional treatment? Is it a surgical thing or whatever? That's all well and good, but reducing inflammation and getting good blood supply help everything. And you look at most neuropathies. Look at diabetic neuropathy, for example. A significant part of that is ischemic. Once you resolve the ischemia, that means you improve the blood supply of the nerve. It'll often do much better. Plus, when you reduce atherosclerotic risk factors with the low-fat vegan, you're also going to reduce diabetes risk factors. And once you avoid the hyperglycemia and the microvasculopathy that goes with diabetes, you'll often have a major reduction in the patient's symptoms. So that's what you want. Well, anyways, I didn't get to go through all this stuff with the lady because her friend walked by and our conversation kind of abruptly ended because of that. But in my experience, this is very typical. People want a quick fix. They love the idea of take this pill and everything will be okay. And that's the first thing her private doctor did, was just gave the guy some pain pills. But the pain pills don't fix anything. And they also carry with them their own risk factors. You get the NSAIDs, you can get gastric ulcers, you take the opioids or something stronger, and you could have, all kinds of respiratory failure. It's pretty serious stuff. But like I said, a lot of people want a quick fix, but there is no quick fix that I'm aware of. I deal with spine every day. And, in a perfect world, you'd have time and you would systematically go through all the history, the previous workup, any prior imaging, ask questions, or examine the patient to make a correct diagnosis and treatment plan. But I'm just making the point that a lot of times people don't have adequate blood supply to their organ system, and you can easily fix that. So why not fix that, see how things go, and decide what you have to do next?